This week, the FDA established the Coronavirus Treatment Accelerator Program, which is expediting the development of new antiviral and other therapies, and they're doing it on a very rapid basis. And I think we're having some very good results. We'll tell you about that. HHS continues to speed the development of therapies derived from human blood that have the potential to lessen the severity or shorten the length of the illness. And as you know, last Saturday, the FDA also gave emergency authorization for hydroxychloroquine. And the hydroxychloroquine is I hope it's going to be a very important answer. We're having some very good things happening with it, and we're going to be distributing it through the Strategic National Stockpile. It's going into the Strategic National Stockpile to treat certain patients, and we have millions and millions of doses of it, 29 million to be exact. In addition to that, we're making it, and we're also getting it from various other locations and countries. In one case, I called Prime Minister Modi of India this morning. They make large amounts of hydroxychloroquine, very large amounts, frankly. And I said they had a hold because, you know, they have 1.5 billion people, and they think a lot of it. And I said I'd appreciate if they would release the amounts that we ordered, and they are giving it serious consideration. But they do India makes a lot of it. But we have already 29 million, if you look, I mean, that's a big number, 29 million doses. And we've got millions of doses that are being made here, and many millions of doses that are made elsewhere that are being shipped here, and it will be arriving. We're just hearing really positive stories, and we're continuing to collect the data, but I'll just speak for myself. It's been out for a long time. It's a malaria drug. It's also a drug for lupus. And there's a study out that people with lupus aren't catching this horrible virus. They're not affected so much by it. Now, maybe that's correct. Maybe it's false. You're going to have to check it out. But there's a lot of very positive things happening with that. That's a game changer if that's the case. Obviously, we continue to work on the vaccines, but the vaccines have to be down the road by probably 14, 15, 16 months. We're doing great on the vaccines. I think Johnson & Johnson is leading, seems to be leading in terms of the studies, but we'll see what happens.